is because there's some sort of a joint somewhere, and even though it's a little bit of motion, it's still offering a degree of plantar flexion or dorsiflexion.
I see. So it's the hinge that makes the difference.
Correct. Right.
Okay.
So it's our two surfaces coming together to move on each other versus this is one solid piece. And even though it does produce movement, it's not articulating with. It's not two parts that are articulating. It's one solid part that's being changed its shape to produce movement.
Okay.
Does that make more sense?
Yes, it does. Yeah.
Okay. All right. So, well, that just answered the next question,
Yeah.
right? So, what's the difference between articulating and non-articulating? And
One
essentially,
has a joint.
yeah. Anything that's articulating is going to have two parts that come together to produce actual movement. So there will be an axis and there will be some sort of physical movement. However, if it's non-articulating, it's one solid piece. It may still produce motion, but there's no angle or axis from which to measure it. Does that make sense?
Yeah.
Okay. Okay, and then looking at the same foot above, here they were saying to, let's see, look over the image above, this foot ankle assembly is identified as which of the following types of feet? Yes, you said B. Why would I ask that twice? That's probably why I don't use this quiz anymore.
That was an easy.
Okay, next question. Oh, that's
upside down.
interesting. Okay, let me see if I can rotate this.
Oh, there you go.
One more time.
Again? One more time. One more time.
There you go. Okay.
Well, it's just that page.
Oh, okay.
Do it
twice.
Okay, so do it boom, boom.
And then scroll up or down.
Done.
Question one.
No, number 5.
There it is, okay. All right, so here, and let me see if I can zoom in a little bit.
You can't tell.
Go to the plus sign next to the rotation.
Oh, there it is.
There you go.
Pretty sure they can
Okay.
hear what she's saying.
Yeah, so I think you're fine there.
Start typing smack the bottom.
All right. So now looking at the image here, okay, what I'm asking you to is identify the component on that prosthesis that's responsible for making sure that the knee unit doesn't buckle or fold during the weight-bearing phase in stance. So again, it's what you're not seeing very clearly on this right now, but again, I'm willing to share. Okay, what it's pointing to is the
extension aid.
here. So right
Oh yeah, so it
here
is.
it comes down.
It's the extension aid, right?
Yeah, not quite.
Oh.
Think about it. What does extension aid do?
It aids in extension.
Exactly. Okay, so this is talking about keeping it locked.
Oh, okay.
So there was another, remember those 4 categories that we talked about? Mechanical stabilizer, there you go. That's actually a manual lock. Okay? But in general terms, that would be a mechanical stabilizer. Okay? Remember I was telling you it's a cable that usually goes where the pocket is, and you kind of pull on the little lever and it unlocks it once you're ready to sit.
Are those terms synonymous?
No, they're not synonymous. Manual lock goes under the table, the heading of mechanical stabilizers. So there's different ones. You might have like a pin that goes through and it's just a little button they press and they unlock it. But this is by far the more common one you'll see. And like I said, usually when they're first learning to ambulate, like their first leg, they'll have it. And then it'll probably be that with time they get more efficient with their gait and they may do away with that. Okay, so essentially it was pointing to that cable and it was trying to ask the question of what that was. If you could identify what function it serves or what is the purpose of that. It's a mechanical stabilizer and its purpose is to maintain the knee in extension throughout stance phase. So they don't just buckle, okay? Now, your thinking was along the right track. Okay, whoever said extension aid, you were on the right track because you knew there has to be knee extension for that not to happen. But because it's a rubber band, it's still dependent on an angle, right? So, you know, there's...
It could still drop.
Yeah, it could
down.
still drop. So what the extension aid is for actually helping in terminal knee extension. Does that make more sense?
Oh,
Get
okay.
there.
Yeah, exactly. It's designed to help it get to that point. All right. Okay, and looking at the same image, identify the purpose of this component on number 7. Was I gave it to you in here. This is a horrible quiz.
Number 7 is a shank.
Yeah, no. So actually, oh yeah, actually you're right. It is. It's pointing to the
Yeah,
shank.
because it's going directly.
It's going right to that pylon. So, what is the purpose of that?
So that's
To
to transfer the
length,
weight
to
from the
transfer weight.
sockets to the
And co
Translates the
assembly.
exactly. So it translates the weight that comes from the socket straight down to the foot ankle assembly.
It has two functions, right? Which is the transferring of the weight and then the adjusting the limbing.
Yes, sir. Very good. Absolutely. So the secondary function is also to adjust height. So they can adjust their height. Well, mainly if they're a bilateral amputee, right? But
Yeah, because I don't think they want a longer leg on one side, right?
correct. They don't. Okay, and then now we go back.
Flip it real good.
There we go. Oh, you're taking me back. All right. So, in looking at this prosthesis, this is actually a posterior view. And in this image, what they're asking is to describe what level of amputee would be wearing this prosthesis. Like, who is it designed for? So, in other words, partial foot, transtibial, transfemoral.
It's transfemoral, right?
Yes, absolutely. Yeah, because what would help you identify that?
Just it comes up. It looks like
the suspension system.
The suspension system, right? That type of belt will come up and around the hip. Now, technically, I should give you a longer view of that so that you would be able to easily identify it, but there's certain characteristics of that prosthetic socket that are very different from a transtibial.
The triangle shape.
Exactly, exactly. So you already kind of get the feeling this is more rectangular. It's got low wall on one side, high wall on the other side. Okay, so, and if it were like a transtibial, you would have seen the band coming down on both sides. There would have been like a hinge or something on both sides. But that's good. I'm glad you guys
It's good. I just had a
deduced
big
that.
bone.
Okay, and then on this type of socket, in other words, a transfemoral socket, what are two buildups that are incorporated into the design of that socket? Two buildups. Where do they take their weight, bear the weight on that socket? Do you guys remember?
Is it like an ischial? The ischial seat.
ischial tuberosity.
It's one of them. Anyone else have one? Because it's all the areas that like, it has to like support for weight, right?
Yes, and so it's kind of like the big mass,
The
right?
meaty
so,
areas,
so
right?
yeah, all the beefy areas. So if you said like anterior thigh, yeah, all of that is exactly where it weight bears. And then if you ever have doubt, just look at the socket itself. And remember I was telling you with a quadrilateral socket, it's gonna have the buildups we said up here at the front, right? It's gonna have a bulge that goes into the hip flexors. So you know that's weight bearing, right? Kind of like the patellar tendon bar on
Yeah.
the transtibial. Okay. All right. Why are most transtibial sockets attached to the pylon in a slight lateral tilt? So if you're looking at it from in front, it's sitting in front of you. It looks like it's tilted just a little bit off to the side. You're close. Try another bone.
Yes, and you responded with that the tibial head.
The fibula. Yeah, he had the, he was like, damn it, I was there. Yes, exactly. So
Fibula.
it's the fibular head, right? Remember on the transtibial, okay, fibular head is always lateral. So lateral tilt, automatically you can assume is referring to that bony structure right there. And remember we're talking, it is a real sensitive area, so if you ever sit with your legs crossed for a little bit, you end up with a red dot right there.
Yeah.
So the fibular head is one of those bony structures that doesn't have a lot of padding over it and just needs to be protected. Okay, so I think that was the quiz.
Just one. Just one.
No, you're gonna get all of them. Okay, now.
And that would have been the quiz had we taken it.
Yeah, yeah. I probably would have had to revise it before I issued it out.
Okay.
Definitely would have had to revise it. Okay, so I'm gonna go through the individual pictures first, and then we'll come back to some of the other photos. But
Those were all your old prostheses?
yes, how did you know? You recognize the gym? Yeah.
Looking at it.
Okay, yes, those are all my old legs. So, so at least there's some historical memory of them, right? They're being preserved for
Maybe.
posterity.
No. Next to you.
Right.
Right.
Okay. So
Do you need help? Do you need help?
We're gonna take a look here.
The shirts are here. We'll give them out right now after
You were done?
this fast.
Okay.
I was driving home. I was doing errands and stuff, and they called me from the place. They're like, "Oh, it's perfect. Oh,
All
it's
right.
perfect."
So looking at this prosthesis. All right. First of all, what level of amputee is going to be using this?
Hemipelvectomy? No.
No, not quite. I know it looks like it
Super
could be.
long.
I know it's super long. It's a transfemoral. Yep. Okay, and this is definitely an old school. This is one of those wooden, heavy legs. This is old.
So, this is for my aunt for a shirt.
For what?
For my aunt with a shirt.
Give it to me after. Because I'm right now I'm concentrating on this. That's gonna stay there. So yeah.
So actually, let me start at the bottom and we'll work our way up. Here we go. Okay. Look at that old foot.
Non-articulating.
Yes, and that's probably all we can say about it. It's a non-articulating foot. It's not a satch. You don't see the change in definition here. It's covering something. We just don't know exactly what it is. So I wouldn't ask you on that. However, if I could uncover it and you saw like black plastic or white plastic peel coming down it, that would tell you it's a safe foot. Exactly. All right. And the distinguishing feature for a satch foot would have been the cushion heel in the back, that yellow, that
I don't think
triangle.
it'd be an ESER, so that only needs one.
Right, exactly. If we could uncover it and see it, then we'd know, right? But this is definitely non-articulating foot. It's we don't know exactly what it is. Now we come up, and if you're looking at the outside of this, you can already see this is a hard plastic here. What type of frame or material? What is this? Endo or exo?
Exo.
Exo.
Absolutely. Okay. Now coming up to the knee, remember we talked about the
Like
knee
in the
unit
same bone,
too.
same side.
All right. Just in looking at that, this knee unit, how would you classify it? Single, yeah, hinged, single axis, right? That's pretty much all they're offering us here. This happens to be one of those old school ones that had, it did have a little friction device on the inside, and it was just with a screw, the pressure of a screw. So the friction was a constant friction. It didn't change. So as they went through the gait cycle, it was just
They
like
kinda had to kick
swing
it.
it, snap. It would snap when it gets to terminal knee extension, and then they'd slam the ground with their heel and move over on that. Okay? What you're seeing here on the outside is actually the manual lock. There you go.
So that's
This
the
is
mechanical-
a much better picture of that manual lock right there.
That's the mechanical stabilizer.
That's the mechanical stabilizer. There you go. Exactly it. Okay? Now, another thing that's kind of interesting about this prosthesis is that it actually does not have a hole. Remember we were talking about
Oh,
they're
the-
always like
so
part,
that-
yes, suction, full suction, partial suction,
suction.
or no suction. This is an example of an old-fashioned no suction. All they did was put on socks, and they had a belt, and that was it. Okay, the inside was literally like wood. It was like shaven down wood. Okay.
Marcy, for
Yeah.
the suction one, do they still wear a sock or no?
They can. That would be a partial suction. And usually in the first year, as their limit changing size, they're gonna have to. They're gonna have to because it just dances around too much. So it's just yeah. Now, the only exception that I've seen, but even then, is like when they have a gel liner with a pin, the distal locking pin, because that's on pretty secure. But some patients just don't like the space that's in there, so they use the socks to kind of cushion it, right? All right. So I think that's pretty much what I can tell you. So we said it was transfemoral. And here, what I can tell you about the socket, we know it's a quadrilateral, looking at the shape. Again, we know this is the front, this is the anterior, this is the posterior aspect. So it's got a high lateral wall, and the medial wall, although we can't see it, is lower. The anterior wall is high, and the posterior wall is a little bit low. So it's got a little shelf where the ischial tuberosity sits, and yeah, that's pretty much all I could kind of point out to you here. All right, so let's go back to. All right, now, okay, let me explain this one.
Okay.
This is, yeah, this is also one of my older ones, but it was such a good example of a patellar tendon bearing and a supracondylar suspension that I loved keeping it because the socket was just beautiful to look at. However, the satch foot that it used to be, the cushion literally dried up and dissolved, almost like an eraser. It crumbled.
That's why
Literally.
it's like.
That's why it's missing a heel. So it would have had the heel there. It had a cushion at one point, but now that's gone. It just literally crumbled away with time.
That would be an example of an endoskeleton?
Yes,
Yeah.
that's exactly right. Okay, so first of all, what level of amputee patient would be using this?
Transfemoral.
Transtibial.
Oh yeah, because it has the extension, the patellar bar.
Yeah. Okay, so there's no knee unit, right? So the socket is receiving the residual limb, and they have an anatomical knee. Okay, it is endoskeletal, like you said. If it still had the cushion heel, I would ask you what type of foot it was so we could identify that as satch. We got a pylon, right, there in the middle. That's the type of shank it has, and you know the purpose of that, right, is to transfer the weight from the socket to the foot and to restore limb length, right? Okay, now coming up to the socket, we see it as a transtibial socket. I'm going to zoom in a little bit here.
Whoa.
Okay, maybe not so much.
Drag the picture.
I think if you click it, hold it, and then move it up.
There we go.
There we go.
Thank you. Okay, so let's look at the socket. All right, so one thing that you cannot really tell by looking at it, well, when I remind me to show you when we pull away, that the socket is built in a slight angle of flexion. And remember that's so that it's just a little bit. It's not a whole lot. It's just a slight degree of flexion.
So it can put tension on the patellar bar.
Exactly. So it can increase the amount of tension on the patellar tendon. Okay? So in coming up, this is the front of the socket. And here, this marked indentation right there, that's the patellar tendon bar. Okay, that's where they weight bear. It's one of the primary weight-bearing areas for the transtibial. All right, in this particular socket, you see that it comes up and over the kneecap. This one happens to have a relief. It's not seen commonly, but this one happened to come up over the patella, and there's actually a gap between the bone itself and the kneecap itself. So between the kneecap and the prosthesis. So that's considered a relief on this one. But you're not gonna, like, that's not the typical thing. What I do want you to notice is that this part does come up and over the condyles, the femoral condyles, okay? This rough stuff that kind of looks sprayed there is a liner that goes inside that socket. So they would put that foam liner on first, and then they would sink into the prosthetic.
Okay.
Okay? On this one, I would have drawn a circle around it, but like right here, oh, sorry, right there, that's the relief for the fibular head. Okay?
I wanted to ask, how can you tell that it's endo?
An endo?
Endoskeletal, like an or endo.
Okay, good question.
The way that I don't know if you care, but the way that Charlie said it right now really made sense to me. Where it's like if you're looking at the pylon, it's like if you're
The
looking
bone.
at the tibia, like X-ray vision of the tibia. You get me?
That's excellent.
If you're
That's a
looking at-
great analogy.
If you're looking at the pylon,
It looks like a bone.
Yeah.
It looks like-
Okay, so yeah,
It's like
so this imitates the bone, right? So
Right.
bones are on the inside, that would be
Right.
endo. Versus that old one that I showed you in the first picture, everything was on the outside. It's like a lobster, right?
It's
Hard
built
shell
to
on the
like look
outside.
like an actual leg.
Exo.
Exo.
No.
no. the pylon, first of all, is the metal shaft, right?
Correct.
Right.
The term that connects the two ends is a shank, but
Right.
when you have the a pipe that
this
goes on
pipe.
the inside, that's specifically referred to as the pylon.
Okay.
Okay.
And you're
So
saying
you're only going
that
to see that on the endo.
because you can see the pylon, it's endo,
Correct.
and if you can't see the metal shank or
If
metal
you can't
shaft,
see it,
If you
if
can't
you
see
go
it.
up and you squeeze it, you could feel if it is, okay? So if it's covered with foam, it's still soft, right?
Mm-hmm.
Then you know it has to have something solid in there. This thing is not standing on foam.
Mm-hmm.
So that would tell you right there that it has the endoskeletal pylon.
okay, I'm kind of getting what he was
Okay.
talking about. So, I guess I thought that endo is exo meant like the part where you put the limb, whether it's soft or hard. That's what.
Okay, and then that kind of makes sense too, because that's exactly what it is. So this one, when the finished product is done, they'll cover it with a foam and a natural skin tone,
Right.
right? But when you touch it, you're gonna feel it's soft. It's gonna
Right.
feel like a leg.
And that'd be endo, right?
That would be endo.
Right, yeah.
Now, if you went and felt it and it's solid, hard,
Right.
like a shell, that's exo.
Oh,
Its
okay.
protective covering is more on the outside.
So that still stands true about the material of the part where you stick the limb in.
Yes.
Okay, but again, you're saying a better way to tell. Like Charlie was saying is that if you can see the pylon endo, if you can't see it, exo.
Correct.
If you cannot see it, so like this
Well,
one.
but again, I put a little star by that because it might be covered in foam, so you might not see it,
Oh.
but you could feel it. You know
So
what I'm saying?
it still depends on the material then.
So this is endo. You know what? If it has something on the inside that's maintaining that structure, that's translating the weight, that's adjusting the height.
Right.
Okay, that's an endo if it's on the inside. If it is all from the outside shell, then that's your exo.
Oh, okay. I think I'm getting it.
Okay.
So just having that metal shaft in there. Well, I guess because like I'm looking at the picture and okay, I see what I mean. Like this picture here,
Exactly.
this is an exoskeleton. This doesn't have. This one
the
doesn't
hard
have this.
shell on the outside. It's never. This will not have hard shell on the outside. It'll only have soft, if anything.
What would be soft?
A foam that covers this to give it the shape of the leg, like the final product. The person could choose to either have it look like a leg or not. Okay, and so in some cases they may not come to you looking like this. They may come to you with foam on the like outside here that's covered in like just a soft material that matches their skin tone. All right, but the difference is that if you squeeze that one, it's soft. You know there's got to be a bone-like structure on the inside.
Still be endo.
Still be endo.
And then this one, if you're squeezed it, well, it's a hard. It would
It's
be hard.
hard, yeah, and so you know right away all the stability comes from the
so
shell.
I guess I
Yeah.
can. Oh, okay, I'm getting it. So I guess you can kind of tell if you were to touch it, but if you were to see it on the picture, I guess that's the how could you
The
tell
only
if
way a
it's-
picture would identify it is if you're seeing exactly like that.
Like if you're seeing this,
Yes.
endo.
Yeah.
If you're seeing this, exo.
Correct.
Oh, okay.
Okay.
Thank you very much for
Yeah,
that.
yeah.
Sorry.
But no, don't apologize.
It's because I was reading the paragraph and it wasn't making sense to me.
Okay.
The difference.
It's okay. That's okay. All right. So you guys are pretty solid on that, the endo
Yeah.
and exo. Okay.
Yeah.
All right. So let's go back.
Identifier. Looking. It has a pylon. Oh, wait. You can see it.
Okay. Here is another one. Okay. So let's.
Looks like a.
Okay. So this one I'm going to leave kind of open for a second, and let's look at it. carefully. So we see a foot unit. Then we've got, what is that?
Angel.
Angel, what is
Oh,
it?
that would be, if you can see a pylon endo.
Good. Okay, so it's an endoskeletal prosthesis with a pylon. And then we have a knee unit there. And then we have a socket. So what patient is wearing this? Transfemoral. Transfemoral, okay? All right, now, let's look a little bit closer at the foot.
That would be an articulating foot, right?
Yeah, let's see.
Oh, okay.
All right. Okay, so now look at this carefully, okay? On the bottom, there's a hole where the screw comes up and in and attaches to the pylon, okay? This has a black plastic heel that's running down.
So it's
So you see a hinge here?
No, there's no hinge.
There's no hinge, right? So what foot would this make it?
safe.
Safe, exactly. Very good. Stationary attachment,
Oh, I see.
flexible, endoskeletal.
Okay. The reason I said articulating is because I saw that thingy and I thought it was like a multi-angle, like.
Exactly.
Yeah.
Okay. Now, and that's good. I'm glad you brought that up because it does have a role, right? It's just not dynamic. It locks. So that's where we make the adjustment for toe in and toe out.
Oh, okay.
Okay. So the prosthetist would just
You
unscrew
would-
it from the
Yeah,
bottom.
unscrew it, move it a little bit, and then rescrew it back
Exactly.
in.
So it's
okay.
it's safe because it doesn't have a hinge.
Correct.
So it's safe is
So it's non-articulating.
Correct. It's
non-articulating.
non-articulated.
If there was a hinge or single axis, it'd be articulating.
oh, okay. So okay.
You got that, Chuy and Letty?
It's well. You were saying, Ms. Diaz, that it was safe, right? And safe is a non.
It's a non-articulating foot.
Do they come like
At the bottom, there's a place where you would
like? Do
screw
they
it
come
in.
like if it's not articulating, automatically it's a safe?
No. No.
Oh, so what's the difference between? I
So
guess.
we said there's 3 types of non-articulating. Can
Right.
anybody remember them?
Yeah, ESR, safe, and SAT.
All right.
Yeah.
So there's 3 categories of those.
Right.
So just because it's non-articulating doesn't mean it's automatically going to be a safe. You
Right.
just have to look at the structure of it.
So okay, and you mentioned it. How can you tell if it's safe? Because I couldn't see that in the book.
Yeah.
Like
Okay, so looking at this foot, right?
yeah.
One of the first things that you should see is like first thing if you're going to figure out is okay. We said it's non-articulating. There's no hinge, right?
Right.
Okay. So then I also see that black plastic heel. If you're looking at it from on top, you can see it extended to the forefoot. Okay, so it came down to like the metatarsal heads.
The
where
little
toe
black
braces.
foam, black material.
It's that black plastic heel that we're talking about.
Heel, okay.
Yeah. Okay.
The shape
The other thing, like you can see down
And then
here,
sash,
it's
you
got
can
a
tell because it
stationary
has like a big
attachment. When you see a hole on the bottom
Oh.
where it attaches up, it's
Okay.
just that's it. There's no hinge.
Okay. So if it has a stationary attachment on the bottom where you see a hole, and then the black heel, which you
Yeah.
can see better from the top
Yeah, from
perspective,
above.
that would make it a safe.
Correct.
Oh, okay. Thank you.
All right. Okay, so now we're going to come up a little bit. We already talked about pylons, what their purpose is. You can see this one here.
Stationary.
Now, this is kind of interesting here.
Oh,
Okay, so this has a different type of, okay, anybody want to take a guess? It's this cable with this spring. This is a spring right here.
I feel like that spring would put it into like terminal knee extension.
Yes, so that would
That's
make
the
it a,
extension aid.
yes, all right, you guys are getting it. So this is an extension aid, a different type of, you know, I said they're usually rubber bands and stuff.
Extension aid.
This is a different type of one. This one has a spring mechanism. All right, so you can see that when they flex that knee, that coil's gonna open up, and then when they release the tension,
It's just gonna
it's
spring
gonna
back.
recoil back and help them get to terminal knee extension.
Extension aid.
Okay,
No, not the spring. The spring.
Oh, the
spring.
coil?
Yeah.
Oh, okay, I see.
all right.
The coil.
All right, now, so sometimes it takes kind of looking at it and like, let me think about it. And honestly, when one of these comes into you at a clinic, what you guys are going to do is play around with it for a little
Mess
bit,
with
just
it.
to kind of figure things out. So you'll be able to get your hands on it, move it, and like, oh, okay, this is where the extension aid is at. Okay, this is where it stabilizes. So it'll make a lot more sense when you can have the hands on.
When you grab it and you actually move it.
Yeah, that's why I missed that.
Ah,
Even though they
yeah.
were
I was
old, I
thinking-
missed that.
It would have been great to actually have those
Yeah.
in 10 hours.
Yeah, definitely. I hate to say it, but I'm just waiting for the next generation to pass on and start collecting them again.
Is this a transferal or?
No,
Oh, transformal, right?
transform.
Transformal.
It has a knee joint.
Yeah.
Just to kind of
See, and these are not pictures that are in the book itself because these
Yeah.
are the old prosthetics that I have.
Except for this
That
part though.
white string, is that mechanical
Oh,
stabilizer?
never mind.
No, this cable works.
It's a part
Oh,
of the
it's part of
extension.
it.
Yeah. So it's part of that extension aid.
It doesn't- it's not going
The
all
little
the way
cup
up.
that I can see there, it's not the same as this, is it? Like on this picture over here? They're not the same, are they?
No, not
Oh.
not necessarily. That's just a plate where they are securing the socket to the knee unit.
Oh, it's a plate.
Yeah, it's just a little
Oh,
plate
it
that
looked,
kinda
that was
comes
like
out.
a cup. Oh, okay. I see it.
So that's the plate, and this is just shaved off.
Oh, okay.
There you go. Okay, so look at the knee unit itself now. Let's look at that for a second. And we talked about the knee units, right? On here, we said they could be two types, right? Single or
Multi, no, single.
starts with
Yeah.
a P.
Polycentric.
Yes, polycentric. There you go. All right, so it could be polycentric, and here is an example of that.
Yeah, because you can see that it translates forward and back.
Like there's a little roll.
All right, so you see that one is the actual hinge, the other one is gonna allow for a little bit of slide on there. Just, it's very small amount, but that's what it is. So when you see those two kind of, they both look like hinges, usually you've got like the one that's the actual hinge for the knee joint, and then the other one acts as the translation part. So that's a polycentric linkage there. All right, now coming up, this socket is a little bit different. I'm going to zoom out a little bit. Sorry. Okay. So the socket is a little bit different. This one is for transfemoral, but it started off, the guy wanted like the most secure socket he could get. So they built him an ischio containment socket. Remember there was two types of quadrilateral or ischio containment. So they built him the ischio containment, and poor guy, as much as he tried, he just couldn't tolerate it. So what they ended up doing was they ended up opening it up, and they created a modified kind of quadrilateral socket for him. So this one's just a little bit different. It doesn't follow all of the definitions that you see in the textbook that show you quadrilateral is one thing and the ischio containment socket is a separate one, okay? So in this case, it basically, the back and front walls are almost the equal height, and then it's just kind of opened up all over the place. What you're not seeing